The solution that we're going to run through today is the Safe Island Citizen Care Pod entry management and entry venue screening solution. So this is a blockchain-enabled solution for large venue screening, industrial facilities, and essentially to remobilize private enterprise into getting back to some kind of new normal. This mobile solution can be put on the back of a truck, on a boat, on a trailer or a train to get to any destination globally, and then you can set them up in about a day. Each one of these pods, the 20-footer, will put about 180 people through an hour. The 40-footer unit that we have has 8 to 10 windows. You can put about 250 to 300 people through an hour, and they do daisy chain together. We do have 1,000 up to 10,000 person an hour systems available, so for large venue screening.
Your name would be pre-registered. You'd come up to the table upon entering the event and have to go through the screening. We have our temperature sensing biometric camera, so we'd look into the camera. The camera would let you know if your temperature is okay or not to proceed. Then once you've been okayed by the camera, you'd come over to the actual window itself. The nurse inside the window would administer 2 tests depending on what the organization had wanted. We have a serology test and we have an antigen test. The serology test is a blood test that tests for antibodies itself. The antigen test is a nasal swab, and we test for both. Once those tests are administered, there's a timer set to a 15-minute time frame. You then go over to the tablet. You enter in your declaration that everything you administered is fair and just, and you get sent to a waiting area on the far side where you are social distanced and monitored by your contact tracing badge until you receive a notification to come up that your test results are positive or negative.
We have been talking to AHS about expanding their testing capacity to private enterprise so that people can book one of these to come to their employee center and test their people on site, so they don't put that risk on their employees to always go to the public health centers. The big piece that differentiates us as well with the AHS solution is this is a global framework. We're definitely doing a good job here in Alberta and Canada, and Health Services has been doing phenomenal with all of their first responders, but the solution that we've put together is a global problem, not just here in Alberta. So we have sized this to not only meet the CDC and the WHO recommendations, but to exceed them.